Hi, welcome everyone to our Cecilia Health webinar. Today we will be talking about all the medication tips your doctor didn't have time to tell you. Nanette, one of our pharmacists, diabetes educators, will be the presenter today. I'm Emily. I'm one of the diabetes educators and a dietitian, and I'll be here as well. In case you have any technical difficulties, there is the number at the bottom of your screen, 800-263-6317. Please reach out if you're having any problems. But thank you again so much for joining us today. I think the slide got stuck. Oh, there it is. Okay, thank you. So this is meant to be an interactive program. The idea is that there is a short presentation where Nanette will be going through all the different medications, injectables, insulin, etc. today. But then at the very end, there is time for Q&A. So, and you'll see that right there in your toolbar off to the right underneath the questions tab. So if you have any questions or any comments or anything that you want her to talk more about today, please feel free to enter that in there and she'll have time at the end to address that. And as a disclaimer, we know that the information you are about to hear may motivate you to make some changes, but as always, please do talk to your doctor before making changes to your current routine. The Cecilia Health Certified Diabetes Care and Education Specialist is very knowledgeable with everything, but again, please do talk to your doctor before starting anything new. So today, our pharmacist diabetes educator is Nadette Sabel. She is a pharmacist who left retail and became a certified diabetes care and education specialist. She's been with Cecilia Health for 9 years, and in the summer, she volunteers at a diabetes kids camp. She loves watching movies with her husband of 31 years, and in addition, she enjoys quilting, spending time outside, gardening, as well as bird watching as well. So thank you all again for joining us, and Nanette, I'll pass it off to you. Thank you.
Thank you, Emily. Again, my name's Nanette. Everybody calls me Nan, and I'm going to be your presenter today. And I'm going to talk about all the medications that are out there to help improve blood sugars. So that's going to be the oral medications, injections that are not insulin, and insulin. I'm going to talk about where and how these drugs work in the body, the recommended dosing, any additional advantages to the medications besides the blood sugar improvement, most common side effects, cautions, or warnings. I'm also going to mention how much of a decrease in your A1C you can expect at the maximum dose. Now, many of the medications I'm going to be discussing also come in a combination form, meaning one pill contains 2 or 3 different medications. However, today I'm going to be covering the individual medications. Finally, we're going to briefly discuss tips on medication adherence. Now, before we begin, I want to talk about all those wonderful commercials you've seen on TV about the diabetes medications and decreasing your chance for heart attack, stroke, congestive heart failure, and helping with kidney function. The reason you're seeing these is because back in 2008, the FDA mandated that all manufacturers of diabetes medications were to conduct research to ensure that these drugs would not increase the risk of heart attack or stroke. And what's been proven so far is that none of the drugs increase the risk of heart attack and stroke, and in fact, some of them reduce the risk of having a heart attack or a stroke. And I'll mention which of these drugs do that as I discuss them today. So we have oral medications, injections that are not insulin, and insulin. So I'm going to start with the oral medications, and these are a list of fancy names that represent all the different drug classes of oral diabetes medications. And each of these classes work differently from one another in regards to how they lower blood sugars. And within each drug class, there can be multiple brand names and generic names, so it gets confusing. Hopefully this presentation will help clear up some of this. The different drug classes of oral diabetes medications include biguanides, SGLT2 inhibitors, TZDs or thiazolidinediones, sulfonylureas, DPP4 inhibitors. There's one oral GLP-1 receptor agonist, glucosidase inhibitors, and meglitinides. And those names kind of talk about where or how they work in the body. So first we have metformin, and that also goes by glucophage, glucomet, Glumetza, and Fortamet. And metformin was first approved in the United States back in 1994, and it's become the most frequently prescribed medication for diabetes. Now, metformin works mainly on the liver. It's said that the average person with type 2 diabetes has 3 times the normal amount of glucose is released by the liver, and metformin helps to cut down the amount of sugar it releases, and by doing that, improves your blood sugar. It also helps the muscles use some of the sugar from your blood, which also helps improve blood sugars. In addition, it also prevents some carbs from being absorbed from your intestines. So if it doesn't get absorbed, you don't have to lower it. Now, metformin is recommended to be started at 500 milligrams twice a day with food and increased over time. And the maximum dose is 1,000 milligrams twice a day with food. It should be taken with the last bite of the morning meal and the evening meal, and this is recommended to take with food to prevent the most common side effect, stomach upset. If you take it with food and you're still having stomach upset, your provider can switch you to the extended release formula. And the extended release is still taken with food, but it dissolves at a slower rate, so you usually don't have the stomach upset. Now, there's multiple advantages to metformin. It's inexpensive. It doesn't cause weight gain or low blood sugar, hypoglycemia. An additional benefit with this type of medication is it can decrease cholesterol. And research has shown that metformin may have the potential to reduce the risk of heart disease. Now, the most common side effects, nausea, stomach upset, bloating, diarrhea. Some people can have headaches. With long-term use, there can be, it can prevent your body from absorbing a vitamin called B12, so your doctor may periodically check your blood to make sure you have the right amount of B12. Like I mentioned, the extended release formulations can help minimize the GI-related side effects. And if your kidney function decreases too much, metformin should be stopped. Now, metformin can lower your A1C by up to 2%. So when you start taking this, let's say your A1C is 10, and you were started on metformin, once you're at the maximum dose, it could bring your A1C down to 8. Now, the recommended goal for A1C is below 7, so if your A1C only came down to 8, it would make sense that your provider would want to add on another medication. And so the 2% decrease with this medication is at the maximum dose. Eating balanced meals with portion control and being more active, you can definitely improve your A1C even more. And with all medications for diabetes, it is universally with diet and exercise are the words that's in the package insert. So we're always encouraged to be more active and to pay attention to what we're eating and eat more balanced meals. So let's move on to the SGLT2 inhibitors, and this stands for sodium glucose cotransporter 2. Now, the brand names for this include Invokana, Farxiga, Jardiance, Stegletro, and Brenzavvy. Now, in people without type 2 diabetes, when blood sugar becomes elevated around 180, the kidneys will help lower blood sugar by excreting sugar through the urine. With type 2 diabetes, this doesn't work as well. So the body doesn't get rid of the extra sugar through the kidneys until the blood sugar is much more elevated, higher than 220 even. So the SGLT2 inhibitors drugs help your body get rid of the extra glucose through the kidney sooner, improving your blood sugar. And this medication is taken once a day. Now, a lot of side effects are because of where it works. Possible bladder infections, increased urination, yeast infections, and all of those are for both men and women. Diabetic ketoacidosis is possible, but it's very rare. And these can lower your A1C up to 2%. Now, the potential benefits for SGLT2 inhibitors So there's no low blood sugar. There's no weight gain, even weight loss. It can help lower high blood pressure. Invokana and Jardiance may decrease the risk of heart disease and congestive heart failure. Invokana, Farxiga, Jardiance, and Brenzavvy have a benefit to improve heart failure. At this point in time, Invokana, Farxiga, and Jardiance can slow the progression of kidney disease. So there's lots of potential benefit there. Now, the next class of drugs are TZDs, or thiazolidinediones. And we have one drug called Actos or pioglitazone. This drug helps the body be more sensitive to insulin. This also decreases the amount of glucose released by your liver, and it can take up to 12 weeks before you see the full benefit of this medication. It can be taken up to 3 times a day, and it can be taken with or without food. Now, possible side effects are headache, sinus infection, swelling, or fluid retention. And if you have liver problems, you may not be a candidate for this. If you have, it can help with heart disease to some extent, but there's what they call a black box warning on this medication, and that means that it can also cause or worsen congestive heart failure. And so with this medication, it's often recommended that you monitor daily your weight and swelling, and it can lower your A1C by up to 1%. Now, I'd like to take a minute and talk about side effects to any medication. If you experience possible side effect to a medication, it's recommended you contact your doctor and let them know what you're experiencing. That can be a message in a online portal or calling and leaving a message for the doctor. But it's safer to let the doctor know what's happening instead of waiting for the next appointment. And understand, no medication is meant for everyone. And in this day and age, we have alternatives to most medications. So with the sulfonylureas, they've been around since the 80s, and the generic name for these is glyburide, glipizide, and glimepiride. The drugs in these class work by telling the pancreas to release more insulin, and these can be taken once or twice a day. Now, the most common side effects are weight gain and low blood sugar. Because the medication is telling the pancreas to release insulin, if you are late on eating a meal or you miss a meal, you're at a greater likelihood of having a low blood sugar. Another cause is with sulfur allergy. And if you are allergic to sulfur, you may be able to take this medication, but you may not be. Or if you start, sometimes people start it and they're fine and they develop an allergy later on. The other thing is when taking this type of medication, you can burn faster in the sun than you normally would. So it's important when you're in the sun to use a strong sunblock and to reapply it often. And these have been found neutral for heart disease, which means they don't make it better, but they don't make it worse either, and that's good news. Sulfonylureas can lower your A1C by up to 2%. Now, the next class of medications are the DPP-4 inhibitors, or dipeptidyl peptidase 4 inhibitors. And the brand names are Januvia, Anglisa, Tradjenta, or Nesina. Now, people with type 2 diabetes have too much of a hormone called DPP-4 in the stomach. And this medication helps to decrease the amount of DPP-4. And by decreasing that, it's allowing the pancreas to release insulin when you eat. And the medication also helps you feel fuller sooner so you can eat less. Now, low risk of low blood sugar or weight gain, and these are neutral for heart disease and kidney disease. You only need to take them once a day. Side effects can be headache, sinus infection, or disabling joint pain. And these can lower your A1C by up to 0.8%. Now I'm going to talk about Rybelsus. And the active ingredient is semaglutide. And this is a pill that you take that's actually a glucagon-like peptide 1 receptor agonist, or a GLP-1. And it's the oral version of Ozempic, which I'll talk about Ozempic in a minute. people with type 2 diabetes do not have enough of a hormone called GLP-1. And what you do have gets broken down very fast by another hormone called DPP-4. Now, Rybelsus works by increasing the amount of GLP-1, but it's designed where DPP-4 can't touch it. It doesn't get broken down by that other hormone. So because you're replacing a hormone, your pancreas can release insulin when your blood sugar is elevated, and it can help you feel fuller sooner. Now, the starting dose is 3 milligrams once a day with a small sip of water in the morning, and you take it for a month, and that is just getting your body used to having more of that hormone. And then after a month, your dose would go up to 7 milligrams. If you need more blood sugar control, you'd be on the 7 milligrams for at least a month, and the doctor could increase it up to 14 milligrams a day. So again, it replaces the hormone GLP-1 in the stomach and helps your pancreas release insulin when your blood sugar is elevated. Now, most common side effects: nausea, vomiting, diarrhea. This is something that's working in the stomach. It can decrease your appetite. That may or may not be okay. Headaches, changes in vision. It's always important to stay up to date with your eye exams. Possibility of pancreatitis, and of course, weight loss, which for a lot of people, that's a good thing. Cardiovascular benefits. The FDA says Rybelsus reduces the risk of heart disease. Now, if you have a family history of MTC or MEN2, you're not a candidate for this. If you develop hoarseness or a throat lump, you need to contact your physician, and you also want to notify your physician if any vision changes occur. Now, we have glucose inhibitors, and the name brands is Precose and Glycet, or acarbose and miglatol. And these drugs work by delaying carbohydrates from getting absorbed in your intestine, and that keeps your blood glucose lower. Now, these are taken before meals, and it started at the absolute lowest dose and increased every 4 to 8 weeks if needed. And you want to slowly increase the dose to help decrease those GI-related side effects. Now, weight gain and low blood sugar are the most common side effects. And when you have a low blood sugar, if you're taking one of these medications, you need to treat the episode with glucose tablets. Other types of treatments will not absorb in a fast enough manner. And it's recommended to use these in people with liver or kidney problems, and they can lower your A1C by up to 1%. The next drug class is meglitinides, and these are Prandin or Starlex, and the generic names are repaglinide and neglitinide. Now, these medications stimulate a rapid insulin burst, so it's important to take it before you eat, so up to 3 times a day. The side effects include low blood sugar and weight gain, and they can lower your A1C by up to 2%. Now, let's talk about injections that are not insulin. Now, we have the GLP-1 receptor agonists, and these are the injection form of the Rybelsus that I just talked about a few minutes ago. There are 6 of these on the market. The weekly injections are Bydureon, Trulicity, and Ozempic. The daily injections are Victoza and Adalimumab, and the twice-a-day injections are Byetta. Like I mentioned before, people with type 2 diabetes don't have enough of a hormone called GLP-1. And what you do have gets broken down very fast by another hormone, called DPP-4. So GLP-1, these injections are replacing the hormone in your body like the pill did. And they're modified so they're not going to get broken down. So, and that's why we can have these injections, and they're only once a week. Now, same as the pancreas is going to release insulin when your blood sugar is elevated. It's also going to improve the connection between your brain and your stomach, and your brain is going to say, oh, you're full sooner than what you were before. So that's going to have a lot of benefit. Now, the most common side effects, nausea, vomiting, diarrhea, could be headaches, weight loss. Monitor any diabetic retinopathy for worsening. This, because it's slowing how your stomach empties, that may impair some medications from working, including oral contraceptives. If you have gallbladder disease, you may not be a candidate for these either. Similar contraindications, family history of MTC or MEN2, contact your provider if hoarseness or a throat lump develop, and thyroid C-cell tumor history with Victoza. Now, additional benefits with these kinds of medications. So remember I said the FDA wanted all the manufacturers to make sure that medications don't cause heart attack or stroke. So Victoza, Trulicity, and Ozempic have been proven to decrease MACE, which is a major adverse cardiovascular event. That's the heart attack and stroke part. So those three have been proven to decrease that effect. They have all been neutral on heart failure, which means it doesn't make it worse, but it doesn't make it better, and that neutral is fine. They've also, Victoza, Trulicity, and Ozempic have all been proven to slow the progression of chronic kidney disease or CKD. And the others, Byetta, Bydureon, and Adalimumab, they don't increase the risk of heart disease. So now we're on to Mounjaro, and Mounjaro is what we call a dual incretin agonist because it works like two different hormones: glucose-dependent insulin-tropic polypeptide receptor and glucagon-like 1 peptide 1 receptor agonist. That's a long name, but it works like two different molecules in one injection that you give once a week. So like similar to the others, it decreases how much you eat. It slows down how fast your stomach empties, which helps with feeling fuller longer and helping with blood sugars. It decreases glucagon. It helps your body use insulin more efficiently. And this can lower your A1C by up to 2.4%. Now, so far, that's the high. If you're keeping track, that's the highest number I've said. And with this medication, they've seen weight loss up to 25 pounds at the highest dose. And it's currently being reviewed for any cardiovascular or cardiovascular benefit or benefit with kidney function. So this is a once weekly pre-filled pen, and the starting dose is 2.5 milligrams injected once a week, and you're at that dose for a month, and then you'd be increased to 5 milligrams once a week. If you need more blood sugar control for that, then it would be increased every month after that. You can lose up to 13% of your body weight. Side effects, to decrease the nausea, you would start with the lowest dose for at least 4 weeks. Possible side effects, because it's an injection site reactions. And then weight loss is always and it should be an effect also. Now, similar contraindications, family history of MTC or MEN2. If you have developed hoarseness or throat lump, contact your provider. And if you have a history of medullary thyroid tumor, you would not be a candidate for this medication. Now we have amylin mimetic injection. So we have Similan or pramlintide, and this is a pre-filled pen. And amylin is sort of like insulin's second cousin. They work together. And by injecting this, you're giving your body more of a hormone that your body doesn't make anymore because of the diabetes. You would inject it before major meals, and it decreases the amount of sugar released from your liver. It helps slow down how fast your stomach empties, and it can help you feel fuller sooner. Side effects, nausea, vomiting, headaches, weight loss, temporary loss of appetite. If you use this with insulin, the dose of insulin should be adjusted to help prevent low blood sugar. The dose is between 60 to 120 micrograms before major meals, and it can decrease your A1C by up to 0.8%. So let's move on to insulins. And let me say at the beginning that insulin is the most effective treatment we have to lower A1C. There's no limit to how much an A1C can be lowered with insulin. So the others had a specific percentage amount. I've seen people on insulin go from very high A1Cs, 14, 15, 16, down to 7. So with the right dose, this can get you where you go. And I like to point that out because I know a lot of times doctors, for whatever reason, want to threaten people with insulin. You really shouldn't threaten with the most effective drug we have for diabetes, but I'm not a provider. And we have rapid-acting, regular, intermediate, and long-acting insulin. And the dose for insulin should be specific for you. It should always be started at a low dose and increased over time to the effective dose for the person. And keep in mind that, like with oral medications, increased physical activity and balanced meals or portion control are still part of using insulin. So the long-acting insulin is Lantus, Tresiba, Toujeo, and Basaglar. We have intermediate-acting insulin, NPH. We have short-acting, which is regular insulin, the rapid-acting Novolog, Humalog, and Apidra. And then the ultra-rapid-acting is Fiasp, Lumigem, and inhaled, we have Afrezza insulin. Now, the long-acting insulin helps keep your blood sugar where it needs to be, and the mealtime or the bolus insulin should be given before meals, and it should, with the right dose, take the carbs that you've eaten and any correction for blood sugar and bring it down to 120, 130 of a blood sugar, and then your long-acting insulin will keep you there. So the mealtime insulin, your blood sugar should go up, the mealtime insulin kicks in, it should bring it back down to around 120, 130 is how these insulins are supposed to work together. So with the basal or long-acting insulin, they're usually injected once a day. Sometimes people will use them twice a day. It lasts for up to 24 hours. These control, like I said, the fasting blood sugar and the in-between blood sugar. And when it comes to the strength of insulin, it can be U100, U200, U300. Those are how concentrated they are. So the most common side effects are low blood sugar, weight gain, injection site reactions. Now, we also have intermediate acting insulin, and we have Novolin NU100 and Humulin NU100, and these control the fasting blood sugar and between meal blood sugar, and one injection usually lasts about 12 hours, so this is used usually twice a day. These have been around for a very long time, so these are usually less expensive, and most common side effects are low blood sugar and weight gain. Now we have short-acting or regular insulin, and that's Novolin RU100, Humulin RU100, and Humulin RU500. And the U500 comes in vials and pens, and yes, that's 5 times more concentrated than the others. So that formulation is used for people who need a lot of insulin every single day. And these are used to improve blood sugars from meals. And again, most common side effects, low blood sugar and weight gain. So we also have rapid-acting insulin, and these are rapid-acting. They usually are done working in about 4 to 5 hours. And we have Novolog, Apidra, Humalog, and Admelog. And these are recommended to be given 15 minutes before you eat, so up to 3 times a day. Again, it lasts for about 4 to 5 hours. So it takes the carb and with the right dose, the carbs that you've eaten and any correction in blood sugar, and they should bring it back down to the recommended goal the recommended range for blood sugar. And we have ultra rapid acting insulins. Now, what they're trying to do is to give an insulin that is going to be as fast as what your body used to make. And Fiasp and Lumajef are getting closer. There's another inhaled insulin I'll talk about sooner, but the goal is to give the insulin right before you eat, and within a couple hours, the insulin is done working, and by doing that, helping to prevent low blood sugars. But you would give these right before you eat. And then we have an ultra rapid acting inhaled insulin, and this is absorbed through the lining of your lungs. Your lung function should be assessed before you start on Afrezza. If you have any lung disease, you wouldn't be a candidate for this medication because it could potentially cause you a bronchospasm risk. You need to not be smoking at least 6 months before you're considered on Afrezza. Possible side effects are low blood sugar, cough, and throat irritation. It's recommended when you use Afrezza to have a sip of water right before you inhale the insulin and a sip of water right after. That helps with the cough. And as you use it more and more, your throat will get used to inhaling a powder and you will have less throat irritation. So those are really temporary. And across the board, all insulins are neutral in regard to their effect on heart disease. So I want to talk about where you can use injections on your body. You can use them in your stomach at least 2 inches away from your belly button or any stars, the back of your arm between the shoulder and the elbow, and that fattier part. You can use your thighs at least 4 inches or about 1 hand's width above your knee, and about 4 inches or 1 hand's width down from the top of the leg. And the best area is either the top or the outer part of your thigh, and you would never inject on the inner part of your thigh. You can also use your buttock where your wallet sits in the wallet area, but not in the lower part. So I encourage my clients, if they're not already using the shortest needle available, to ask for it, and that's the 4 millimeter. When you're injecting with a pen, you're going to inject straight in with the shorter needles. You want to hold the pen in place for a few seconds to ensure that all the insulin comes out of the pen and out of the needle and into your skin. You never share insulin pens. If you were to, say, inject insulin in your arm and then you use that arm to go play tennis, that's probably going to speed up the absorption of the insulin. And you want to make sure you use an air shot when you're using insulin pens. Air shot? What's an air shot? So when you put a new needle on the insulin pen, you need to do an air shot, and that's what you're really doing is you're filling up the needle before your dose. So an air shot, you would dial up 2 units of insulin and you would inject it into the air to fill the needle with the insulin. Then you would dial the dose back to whatever your dose is, clean your skin with alcohol and inject it. And then that way, because you've primed the needle, you're getting your full dose of insulin. Now, for most insulin pens, it's a 2-unit air shot. If you're on a Zoltrophy pen, there's a priming option. If you're using Humalog 500 Quick Pen, it's a 5-unit air shot. And Toujeo and Toujeo Max have their own amount of air shots. And again, you want to make sure that you're priming it so you get the full dose. One more thing, with injections, there is extra insulin in the pen to account for the air shots. So that is always, any time as a pharmacist that I was like in an IV pharmacy and I was in, there's always extra medication in injectable medications. Yeah, you go to the store and you buy a bottle of pain reliever and there's 100 pills in there. Yep, there's only 100 pills. There's no extra. But in injections, in particular insulin, there is extra insulin there so you can do the air shot. Now you also want to make sure that you're rotating your injection sites. use one upper part of your abdomen maybe for a week and then move over to the opposite side for a week and then go down for a week. So by the time you get back to that first area, those spots are healed and you don't have to worry about developing scar tissue. So it's important to take medications as prescribed, and there's a lot of reasons we forget. I'm in that department too. It's important you can use either like a pill box, so you can go back and say, yes, I did take my pills on Monday, or, oh, I forgot, and maybe I need to take them if it's not too late. You can use medication baggies and fill those up on a weekly basis. You can set alarms on your phone. You can put Post-it notes wherever you are every morning. Maybe it's the coffee maker or on the box of tea bags. If you want to keep a small amount of medication in your bathroom, do so, but I would recommend that it's really just a few tablets because the humidity in a bathroom can really have a negative impact on the medication. And if you're going to take it, I want you to have the full benefit. If you're working in an office or you're away from your home for some of your doses, you can ask your pharmacy for a second bottle with your label, with your name and the medication on it, so there's no confusion on what it is. And now we have time for a few questions. Let's see. Okay, here's a question. It's not really about the medication, but how do I communicate with my doctor better? He doesn't seem like he's listening to me. That is a great question. I'm not a doctor, but I can only imagine that having to tell people, you know, their test results, and it's not always easy to say, that sometimes they just kind of have to put a, I don't know what the right word for it is, but it kind of shuts down some of their communication. So I recommend to try and just be more specific. If you're wanting your A1C, ask for your A1C. If he's like, it's fine, it's good, tell him, thanks, I want my A1C number. And if he's like, well, I don't have it, well, you need to go get it because that's one of the things I wanted for my appointment today, and I want to talk to you about it, so I need my number. If it's about you want him to consider you for a medication and he doesn't want to, then that can be, you know, I feel like I could benefit from this medication. What are your thoughts on it? Do you see there a benefit for me besides blood sugar? And a lot of these medications have an additional benefit besides improving blood sugar. You know, it's just being specific, and being specific isn't rude. You know, I mean, if he asks you a specific question, he's expecting an answer from you, and so it should be a two-way street. It should be a conversation with your provider. And you know, if he's like, oh, don't worry about it, well, and you may have a better way of answering this, but to me, it's like, thanks, I didn't ask to worry about it. I asked for an answer to my question. If you have a better way of saying that, use it. I'm sure mine is sarcastic and not necessarily how you want to respond to doctors sarcastically, but so yeah, I always encourage communication with your providers, and sometimes that's where these online portals can be a benefit. You can also, if it has to do with him giving you your specific A1C instead of good or fine or something else, you know, you can ask when you check in if they can print off a copy of your blood work before you go in, so you can see what your A1C black and white before you get in there.
Well, thank you, Nanette, for giving us so much information about the different medications and what is out there, and like you said, other questions to be talking to your doctor about. And here coming up in March, we have another webinar all focused on healthy eating and diabetes. And here in April is a focus on the potential complications related to the diabetes. Both of these, you can sign up online. You can talk to your diabetes educator for more information about them as well. But also, like Nanette said, if you want more resources or what else to talk to your doctor about, you can always talk to your health coach about that, or else check us out on Facebook as well, or also our website as well. So thank you all again for joining us for our Cecilia Health webinar, and I hope you have a great rest of your day. Thank you.